I'm here as a previous sufferer with prostate cancer, and like a lot of cancer sufferers will say, you never think that you've got cancer. You never believe that it's you. After you have that diagnosis, and it's a difficult thing to get your head around. Because functionally you feel fine. You don't feel that there's anything really gone wrong, and nothing changes from the date that you get diagnosed. You're the same person after diagnosis as you are before the diagnosis. But I think in my case, the prostate issues were over a long period of time, and fortunately I had the time to get that treatment and to get some and to have the surgery before it was too late, effectively. So I think that's the key certainly with prostate cancer, is that it's a slow creeping thing, and in your head you believe that it's going to be okay because I don't feel that much different than I did a week ago or a day ago or a month ago, whereas in actual fact you are getting progressively worse with the symptoms that you had. So
did that come on gradually? How did it all come about?
I started to have pain with my, just going to the bathroom was painful. Went to see the specialist, doctor first and then specialist, and through Kim's, and through a fairly rigid set of tests to ultimately have the diagnosis that it was in fact prostate cancer that I needed to. And strangely enough, it was 2 years ago in November the 5th, of all days to remember, that I had the surgery. I'll never forget that day, of course. Now I'm clear of the I'm clear of the cancer on a 3-monthly check. But once your awareness is of the illness, you find out how many other men that not of my age but younger than me, that have actually got symptoms, or indeed sadly have left it too late, and the cancer's then spread to the bones and livers and other things. So for goodness sake, get a PSA test. I mean, it's not 100%, but it'll certainly give a pretty good indication. I don't think men are too worried about talking about, going to the bathroom too frequently or getting up through the night. I had a couple of too many last night, so I was up 2 or 3 times. Well, that might not be the reason why you're up 2 or 3 times. And, making that awareness does definitely help.
For us now, we'll go back to the change room tomorrow and we'll talk about this, and it will be a communication around the lads. So I think, in future, if anybody is struggling with certain things, or we've got one of the lads he talks about it every day, but he goes to the toilet 3-4 times a night. But it might be something that he might go, actually, maybe I need a checkup.
In general, we're quite lucky with our change room that we've got quite a tight knit group of players, and we always tend to look after each other and ask how each other's doing. So I think we're lucky in that respect.
We look out for each other. And I think that's why we're starting to become a successful side. It's because of little things like that where we do care for each other, and we want everybody to be healthy and fit, and so we can go out and perform on the pitch.
It's either genetic or it's just in the stars almost. So it's interesting speaking to people who are at the peak of their fitness, and thinking, well, what can I do to prevent it? In some cases you can't. All you can do is to get those checks and get the treatment that's needed. It doesn't seem to have any barriers on fitness, something like this, which is, if it's lung cancer and you smoke heavily, then there's a fair chance there's a link to it.
Maybe it's a bit naive of me, but I'm only 21, so I don't think it'd even come into my mind at the moment. But hearing your story, and like Darren said there, I think you'll definitely open up my mind to making sure that I'm all safe and getting regular checks over the next few years, because I don't think anyone would want to be in a position where they get told the bad news. So if I can stop it early, or anyone can stop it early, then I think that's the best way to do it. So
I'm 45 now, and actually I should be looking at stuff like this, but I haven't. It makes me, I feel a little bad about it, but I think, I'm sure after this, and obviously speaking to Geoff about his story, I'll be looking to actually get checked myself.